Good afternoon, Chris. How are you?
I'm doing well. Good afternoon, Cheron. How are you?
Listen, I am tickled pink to see my pilot coworker over there working hard from the outside.
Ready for takeoff?
Ready for takeoff. I
We're
love
matching
it.
today. We're matching with the vests.
We are matching today, and today we get to talk about really something like you again. I always say you have the job that is the heartbeat of our organization, and you keep the blood coming into the heart with our partnerships. And we're talking today about going above and beyond for those who need it most.
Yeah, especially when you talk about our seniors, right? So, in my opinion, one of our most valuable assets we have are our seniors, and to be able to connect them with some great resources, especially
Mhm.
now when there's so much going on with COVID and isolation for our seniors. This partner that folks are about to meet, you'll see why they become one of our go-to partners.
That's right. And so we're now joined by Mr. Clayton Carter with Oak Street Health. You guys are doing some tremendous things when it comes to healthcare and getting out and reaching out to people. So, what makes you all different?
So, first of all, thanks for having me, Cheron and Chris. Certainly appreciate the partnership that we have with INLIVIAN. You guys do amazing, phenomenal work in this city, and we certainly, are grateful, right, just to be here today. So, Oak Street Health. When you think about Oak Street Health, we're a doctor's office for adults on Medicare.
Okay.
And we say that we do healthcare how it should be. So, what differentiates us from most other primary care providers is our people. We only see Medicare patients, so primarily we dedicate our time to helping seniors. My doctors have less than 10 patients that they see a day, so we don't double book. Everybody gets their own amount of time with them. I provide transportation for them to and from their doctor's appointments. I have social workers on staff, behavioral health specialists on staff, benefit specialists, because Medicare is hard, to navigate through. And above all, I have a community room inside of my facility that has tons of activities for my seniors because let's just face it, it's been very tough for them, during this time and pandemic that we're in. The social interaction that they have, whether it's breakfast and bingo, whether it's yoga club, walking club, you name it, they love this place and it becomes like a family environment while they're here. So those are just some of the things that probably make us different, right, than other providers.
Yeah. So, I mean, you're definitely right, Clayton. It's I love coming to the Oak Street facility because it's fun, right? It's a fun place to be. I love the coffee and the cookies and all that. But okay, but other than that, you do amazing work, like you said, and this has been a difficult time for everyone during this pandemic, and specifically you working with our seniors. What have you seen um, in terms of changes with health and seniors during this pandemic?
Yeah, so it's been really tough, Chris. That's a great question. So, a lot of our seniors that we see, unfortunately, some of their primary care providers during this pandemic stopped seeing patients in person. So, a lot of the visits went telehealth, and that's hard for seniors to kind of navigate through, especially with technology and things like that. And some of their providers have actually, closed their facilities. They retired early, which is also, very challenging. For us, though, during this entire pandemic, we have been open. Our doors have never been closed. We see them in person, we see them virtually, and we see them as needed. So for us, it's always a welcoming atmosphere when they come in here. And that's just their biggest challenge, whether it's been transportation, getting to and from, it's been hard for them, or just getting in. With our same day, next day appointment, philosophy on here, we see them as needed, and our job is to keep them as well as possible.
So we have comments here from Alethea Outing Ramey. She says, "Thanks for all you do for our senior participants."
Yeah, Alethea, that's my buddy, right? That's my buddy. We do a lot of
And
events.
you didn't have to tell us. We could have just seen.
Yeah, shout out to Alethea, man. She
We
is
could have
great.
just said all the work you do. Now your buddy is the one who shagged you up. But it's all good. You guys are doing great work. So Chris brings up a very good point. The seniors in the pandemic, what do you see them being most overwhelmed with?
That's a great question, Cheron. I would say, number one, they have been the most impacted, out of everybody during this pandemic. So even going outside for them has been scary, right? It's been challenging. Like being isolated, inside also plays a part with their mental health. So that's been very challenging as well. I would say, their biggest concern is change, right, for them too. So like change can be hard. Now you're looking at new providers or new prescriptions or even new insurance. A lot of change is hard. It's great to have a partner, and that's what we consider our patients. It's a partnership with them as well that can identify these challenges that you have and constantly be in a solution seeking mindset to help them, because some of them come in here, it's just them. They don't have caregivers. They may not have family members. They may, just be here by themselves. And what a privilege we have to be able to serve quite often, sometimes the underserved.
So that's great, Clayton. You guys are always just a phone call away. That's what I really appreciate. You never turn down an opportunity to come and build relationships with our seniors and build relationships with our staff. I think that's equally important in making partnerships work. So I want to talk about COVID and the vaccination, and we're still seeing a lot of vaccination hesitancy, not only locally but across the country. What do you think are some of the conversations we should be having now? And I know those conversations kind of change, throughout the weeks, but right now where we're at, what do you think we should be kind of talking about?
Sure, that's a great question, Chris. Education is important. Right. So, when we talk about the time that we're in, nobody's like, we've never been in a time like this before. And it's scary, right, for a lot of folks. But education is important. Me being in healthcare, obviously, I'm privy to more information than someone, who's not. But I can tell you that the science, right, behind this vaccination is quite honestly accurate here. I just saw something the other day where we're at 700,000 people have lost their lives here in the U.S. And as I think about it, that's almost 700,000 people who probably wish they had an opportunity to take this vaccination because it is saving lives. So I think we need to continue to educate, our people on the science behind this and the importance of it. This is the only way we're going to be able to get back to what will be our new normal. But the science, it does not lie. For those people who have been vaccinated, the majority of the time, if they are impacted by this thing, they survive, this thing. And we just want to do our part with encouraging, not just our people, but everybody that get educated, do it for yourselves, but think about the impact it has on others as well. And we're all in this together.
Yeah. So I want to get into you danced over it, but you all are really doing some really extra stuff. I think I heard you say yoga. I think I heard you say spa days. I mean, you guys are really, you pick people up. I mean, what inspired this? You guys are definitely taking it to a different level. I can't come to your facility, but I sure would like to.
Well, actually, Cheron, you can. So, it's called the community room. So that's what we have in all of our clinics. My clinic here in East Charlotte just happens to have the biggest one in Carolina, but it's a community room. So it's open to the community. But we plan a lot of social activities in this place. So yes, the spa days, walking club, yoga club. I had a senior social a couple of weeks ago. I got a black and gold ball that's coming up here where they're going to be semi-formal. I mean, you just name it. It's just a place where they can come in and interact. I got computers in here. I got TVs and music and snacks and things like that. But it's an engaging place to be. And it's a thing that's coming towards Oak Street. So Oak Street, wanted to go that extra mile and provide a community room. We do so much in the community and partnerships that we have. But this is a place where people should come and they feel safe. Quite honestly, I've seen several cases of people that may be having challenging times, going on. And this is like their safe haven when they come in. So everybody is welcome to our community rooms. I would love to invite you guys out to some of these amazing events that we have. They keep us busy and they keep us on our toes. But above all, to see the joy when they leave this place and to know that, we are making that type of impact on people is just phenomenal. So shout out to Oak Street for just incorporating that in our models.
Absolutely.
Well, let me tell you, Clay, the bright green shirts, right?
Yeah.
Right? Yeah, the bright green shirts, the bright green vans. You cannot miss Oak Street coming or going. I went to a site, Cheron, a couple weeks ago for an event, and you had about 12 residents come down with their green Oak Street shirts on, representing lanyards, you name it. They were representing Oak Street. So, yeah, a lot of people are connected. We love it. We want to continue to connect people to your great services. Clay, how many people would you say you serve a year at your 2 locations here in Charlotte?
So right now, I would say roughly we're a little bit over 1,100 in East and over 1,500 in West. So, you're going on roughly we'll have a good 3,000 patients, I'm sure, by the end of this year that we serve. And that's just here, in Charlotte in itself. Again, the numbers are pretty impressive for a company that hasn't been here in Charlotte that long. I think we're going on 2 years now that we've been in the city. But, the impact that we have, when you think about Oak Street Health, we are typically seen in more challenging communities that don't have a lot of resources. But that's no excuse for not providing quality health care. Whether you're driving a Mercedes or whether you're riding on the bus or whether you're in low income, middle, or whatever, everybody deserves quality health care, especially our seniors. They have earned this right, as they have gotten to, a stage in life. And far be it from anybody, that works for Oak Street not to provide what we like to call an unmatched patient experience for them.
That is amazing. An unmatched patient experience. I don't know if I've heard that before. That's pretty cool. So let me ask, do you all ever need volunteers?
Absolutely. So, as people come in, to the community room and come in for tours, they're always asking, how can they help? Obviously I have a great staff here, and that's another, benefit of just everybody buying in. We like to coin the phrase East Side excellence here in our neck of the woods. So we have volunteers that come in. If they come in for the community rooms and they like the events, they're always asking what we, have them do. And we certainly appreciate it. I like to think of them as my Oak Street ambassadors. So they're out spreading the good word. They're passing out flyers. They're meeting people at the grocery stores, like Chris said. It is hard to miss these bright green shirts that we have on them. So yes, anybody that does have time to volunteer, their services, we will be more than welcome to have them representing Oak Street as an ambassador for this place.
Yeah. So Clay, this has been an awesome interview today. I'm really thrilled that we were able to have you on. I got to watch out. You might be trying to take my co-host position here. You're almost too good. Cheron, okay, we've got to talk about that afterwards. Clay is almost good on this. But Clay, in all seriousness, how can people get in touch with you? Let's make sure we have everything there for people to reach out to you and get in touch.
Certainly. So my direct contact, clayton.carter@oakstreethealth.com. You can email me. My office number here is 980-270-7368. My cell phone is 904-885-9582. All of that information. So if you can't email me, call me, you can get a hold of me. Again, man, I am honored, to be here this morning. It is certainly, something that I was looking forward to, today. And again, anytime, anything, you guys need, we are here. The partnership we have with INLIVIAN is just, we're so thankful, for that and the work that you all do for the community here. And we certainly look forward to, continue, partnership and just doing all that we can for Charlotte. So Cheron and Chris, thank you so very much for having me, and check my schedule, man. If anybody's out, you need somebody to fill in, I may be available. I'm having fun. This is
I knew we had the right one today.
We definitely had the right one. Clayton, thank you so much for joining us. Chris, I guess I'm going to catch you in flight. I'll talk to you all later. You all have a great day. Thank you very much.
Have a great day.
Thank you.
Bye now.